So I want to introduce everybody to Jade. I'm going to read her bio. Jade Scott is a doctor of osteopathy with a master's in health science. She graduated from Harvard Business School's program in authentic leadership and clinical management. She lectures at Victoria University, and she founded GrowthRx. Her passion is to empower and inspire others to be better through world-class leadership and education. She's generally just a rock star. She does amazing things for pain education. I really just love her work. So I'm excited to have her, and she's going to teach us all really important things today. All you, Dr. Jade.
Okay, thank you. Welcome, everybody. What an honour and a pleasure it is to be here and to hear so many beautiful accents from all over the world. I am at risk of getting very passionate, and when I do, I speak very fast. So if you need me to slow down, just give me some hand signals. But today, I think, I think vulnerability is in fashion at the moment. And when you talk about leadership all over the world, I think there's certain human traits that we possess from a really young age, but then there's also certain skills and behaviours that we learn just through the experiences that we go through. And today, for you guys in America, we're a day later, is a really special day for me. So it is the 5-year anniversary of one of the biggest crucibles in my life. So when I choose to be a little bit vulnerable today, it's not because I'm trying to do it in fashion. I think that often there's a lot of lessons that we learn from going through some of the hardest moments of our life. And often reflection is one of the greatest tools we have to help us build and grow. But also outside of that, there were so many lessons that I learned from what I went through, not only as a person, but as a practitioner and as a pain providing practitioner, that I feel a sense of duty of care now that the dust has settled a little bit to be able to pass that on. And so there's a few big human traits that I'm going to cover, like resilience, empathy, compassion, gratitude. And the reason why I want to do that and I probably will use some definitions along the way, and that's certainly not to patronize you, because I know we all know what the definitions of those are. But I think just to challenge and provide a little bit of thought leadership and step outside the square a little bit, because often what we learn as practitioners is certainly not what you experience as a patient. And I got to be in that. And so I wanted to share, I guess, all of the emotions and then be able to teach others so that we can do better and be better at what we do. And I think we all share the same common ground, which is helping people, not fixing, not healing, but ultimately helping. Because I think there's a huge amount of pressure on us if we try and be the fixers of the world and life. And so I think we probably just need to take a step back and realise the value that we actually deliver just through human nature. Because the personality that we are is the type of practitioner that we will be. And I saw that relentlessly through what I experienced. So I love to see faces and I love to make genuine connections and relationships, but I'm going to share my screen. So some of you are going to disappear, but I'll kind of do that now because I've just got some slides just to help guide me a little bit. So I firstly just wanted to start off, Rachel, I connected with you through GrowthRx probably less than a month ago, and you are just such a beautiful soul. And I think like many practitioners, like a musician says of the instrument they play, it chose us. And I think this profession and whatever you're doing in pain management chose you. You were kind of destined to be here. And I think that's a credit to all of you that you're making changes. And Rachel, you certainly shine that. And we are, our life shines a little brighter having you in it because of what you deliver. So thank you very much for having me. I think the first thing I wanted to start, GrowthRx is about growth. It's a prescription for growth. It's actually that simple. And that's what we do all the time. But outside of, giving medication or a prognosis or a diagnosis, there's so many things that we can prescribe as practitioners. And a story and sharing a story is a really important part of that. And through my learnings and through all of my study in leadership, what I've become very passionate about is pain practitioners and health practitioners are all leaders. You only have to be leading one person to call yourself a leader. So when you're in a consultation, even if it's one-on-one, leadership is about impact and it's about influence. And you are doing that with one person. So if I start to refer to you all now moving forward as leaders, it's because I genuinely believe you are, and so do you. The first step is to actually think yourself a leader. Step up, show up, and others will too. And I think storytelling is really important. We learn this from such a young age. And what I try and do with my thought leadership is bring in evidence-based medicine and a lot of research and a lot of articles. And you'll hear me tying human attributes into what we can teach behaviorally through mirroring and what is part of our personality and our genetic makeup. And so I'll kind of flip around that a little bit as we go along. But, you know, storytelling, if it defines who you are, it's a story worth telling, and that's why I'm sharing mine today. And it also has a powerful therapeutic benefit. And what I mean by that is the power of social proof is genetic. And often when we are dealing with a patient, we use stories of other patients. I saw this patient once and this is what they went through. And obviously we've got that patient-client confidentiality, but we draw on our experience for social proof, not only to prove confidence in what we're doing and what we're saying, but we do it to help a patient that somebody else, somewhere, sometime, went through something that they're going through, and it shines a little bit of hope on a situation, because above all, if we're not searching for hope, what else do we have in really, really tough times? And I think the important thing about leadership is also followership. Some of the greatest leaders we have out there practice followership all the time, and they're brilliant at it. And that is recognizing the contributions of other people and showcasing that so that others can learn and grow from it. So, you know, storytelling, we start with it as children. We read books to children, and learning empathy and resilience and compassion and gratitude starts in the storybooks of our life. It starts in fairy tales, and it helps grow imagination. And so I think a lot of us do that all the time, and you find that the good practitioners do that really well. You tell a story because you often shift a person away from the pain and the heartache, and you can actually enlighten a situation and bring a little bit of positivity in, or it helps build connections because you show that you actually are sharing that empathy with a person just by understanding their story. So one of the greatest gifts that we possess as humans is the ability to choose. We might not be able to control a given situation that we're in, or we can't repress an emotion, and nor should we simmer down what we're actually feeling. But we can choose how we look at it, and we can choose how we respond. And we do that now. You see COVID at the moment, we are in a point of crisis, and no one is exempt of this emotional and financial impact. But how we respond to that and how we choose to act accordingly comes down to us as a person and the traits and what we learn from others. And also, we are desperately seeking leadership in these times, somebody to step up and show up, because if you do that, others will too. So the flip. And part of my storytelling here is, you know, I'm sure we're all health professionals, and I put that there because we're going to step into that empathy side now, which I'll go into a little bit later. But this is me, and this is the flip. I went from being a practitioner and I surprised myself of what my default mechanism is. I think that we often, in a situation that we're not accustomed to, or that we're often thrown into, how we perceive a situation, we often have no idea. And sometimes medicine gets it wrong. So for me, before I go into empathy and compassion, I'm going to stop the share just for a minute so that you can see me. Now is probably when I tell my story. I was a huge overachiever as a child. I set up businesses. I was a serial entrepreneur from the age of 6. I made my brother breed tadpoles into frogs and sold them at school for $3 each. But what I love from that is the ability of giving people something that they loved. All my classmates loved getting this little miniature frog, and I saw the look on their face when I was the one that delivered that. And so I realized that my job moving forward was to inspire other people in whatever capacity that is to, reflect and do better and be better. And so I threw myself into business, and I am a proud and successful businesswoman. I run 3 practices in Melbourne, in Australia, and I have a team of about 40 wonderful practitioners who I adore. The culture of our clinic is wonderful, and our patient outcomes are our, absolute priority. But connecting with other people is really important, and I set myself up and I worked really hard. I worked really hard for 15 years to get to a point where my businesses ran themselves and I could be a mum. And I wanted to be able to step aside and do what mums do, and even take a year off and enjoy my family and do all those things. For somebody who is such a workaholic, to be able to step away. And I did. I gave birth to my little daughter, Lacey, who is beautiful, who turned 5 2 weeks ago. And I was breastfeeding her for the second time, and something happened. I felt amazing. Firstly, I felt amazing. I felt this euphoric feeling like, what drugs have they put me on? Can I have some more? And I felt my body start to go limp to the point where I dropped her. And I remember seeing her roll onto my lap, and I simply could not move. And I almost couldn't talk. I was kind of trying to call out because I was sitting in the hospital bed, and I sort of remember murmuring, like, hello. I mean, who says hello when stuff like this goes on? There were certain things that I did. I just think, oh my gosh, if I had my time over, which I don't want to have again. And a nurse came in, and she could see that, Lacey started crying. And I said, I can't feel my body. What drugs have you given me? I kind of murmured a little bit. And she said, we haven't given you any drugs at all. And that was the first inkling that things weren't going right. And she I could feel her pick up, I could see her pick up my hand because I couldn't feel it. And she just ran out. So again, how nurses deal with things, obviously in times of crisis as well. I mean, do you leave a patient? I thought there were buttons for that, but she ran out and she disappeared. And within a few minutes, she came in with the physician who did a few checks. And he said one thing to me, which is such a surprise. I kind of murmured to her, I said, I can't feel my body. And he said, are you sure? And I did. And again, there were so many things through this and so many lessons to learn. And I think sure enough, he kind of realized. And then he was kind of, doing a whole lot of tests and all of this sort of stuff. And then suddenly the feeling did come back. And I started to feel my right side again, and then slowly my left side came back, and I could feel things again. But and then everyone left, and we went back business about usual. And he said to me, it's just a reaction to the pregnancy hormones. This happens sometimes. Senior physician of the ward. So I said, okay. And again, this is what shifted my own perception. I knew as a practitioner it wasn't right, and what I was feeling was right, but you trust. Even when you flip over to being a patient, and I did that, I was certainly a patient this season, I was so trusting that I went, pregnancy hormones. I mean, in all of my study, I had never heard that pregnancy hormones could cause full body paralysis. So anyway, not long after, the nurse came back in again, and I looked, I was breastfeeding again 3 hours later. And my husband had actually, he was there, but he'd kind of taken a break and come and gone, and my labour, and there was a whole lot of mess behind the scenes, but he'd been awake for 24 hours. And during this time, I sent him home. So he wasn't there because he needed to sleep. I said, go home, get some sleep, and then come back. So I breastfed again, and obviously the position of my neck looking down at my daughter triggered something again, and then there it was. So the full body paralysis, and at that point I yelled and I called out and I said, it's happened again. Nurse came in, doctor came in, and then it was a code blue. I don't even really remember what a code blue is, but lights were going off, sirens were going off, and no one was talking to me. Not one person during this time of code blue actually spoke to me as a human being. They were doing their jobs. They were doing their jobs well, and my safety was their priority, but there was no communication at all. I heard them say things like, we think she's had a stroke. We think she's had a stroke, like I wasn't even in the room. Take the baby, like I wasn't even in the room. And then my husband came in to find this, and they escorted him out and said, we don't know what's going on. No communication with him either. And next minute I found myself on a trolley being taken away. And that was the last time I saw my daughter for 4 days. She was 6 hours old, and I was still bleeding from the pregnancy, and I was very scared, and I didn't get to see my daughter for 4 days. And my husband was the first male ever to be checked in at Francis Perry Maternity Ward, being the father. It just never happens. And because I was in ICU and they didn't know what was going on, obviously she was too young with no immune system to visit me, and he was also having to look after her. So I didn't have anyone for 4 days. So I then went through a series of MRIs where, of course, they were trying to figure out what was wrong. And, we had 4 MRIs, 4 90-minute MRIs in 48 hours. So for roughly 6 hours, I spent in that MRI chamber with the thumping, with a lot of time to think by myself and be on my own. And I came out after 48 hours, and I remember by that stage, the feeling in my right side had started to come back, and I could only not feel the left side. So I couldn't feel my left arm at all. I couldn't feel my right leg at all. And the other thing that happened is that aside from this being really shocking, and I'm telling you this story, this is not a tragedy, and this is also not a survival story. This is a lesson. I am not the hero in this story, and I'm not telling you this to virtue. This is not virtual signaling. This is not about me saying how amazing I am. This is a lesson I think we need to learn as practitioners. But I had a young intern come in, and he was learning, and he said, everyone's talking about your case. You're an urban myth here at the hospital. The mum who we don't know what's going on. I was like, oh, great. Thank goodness you're a junior, but I'm happy for you to learn off me. And he said, would you mind if I do some neurological testing on you? I said, of course. I'm all about learning. And I said, they think that I've had a stroke. And now I did the wrong thing there as well, because I didn't have a diagnosis and I planted the seed. And often confirmatory bias is dangerous in medicine, because I told this young kid who was about to assess me that they think I've had a stroke. So, of course, his assessment started to try and find more confirmatory bias for that diagnosis. And thank goodness this young kid who was a registrar at the hospital questioned it. No other physician did. And even my physician came back in after a couple of hours after this young guy had come out, and I'd had 2 MRIs with no results back. But what they did know that the mass was growing at a really rapid rate, and my post-eclampsia was dangerously high, and I was at risk of also having a blood clot from this postnatal care. So it started off about 3 centimetres, the mass on the left side of my head, and it was sitting right between right pretty much on my tentorial sheath, just above my cerebellum on the left side, which is probably why they thought. But what they kept saying to me is, this doesn't make sense. And this is the most horrifying comment of all, is that this is in your cerebellum, they said to me when the MRIs finally came back. Are you sure you lost feeling down both sides? Because your cerebellum wouldn't do that. Hang on, let me think about what I felt. Yep, pretty sure I couldn't feel down both sides. They're like, this doesn't make sense. And even one of the physicians looked at me and said, and I was in the room, I was in the room all the time, and I think they didn't understand my medical knowledge. They didn't ask me what my background was. And they said, we need to, out loud, we need to do another MRI for MS. So firstly, I've had a stroke. Secondly, we're not quite sure why you lost feeling down both sides. And now I'm going in for another MRI to look specifically for MS. And this young kid came back in, and he sat down and he held my hand. He was the first person in 48 hours to pick up my hand and hold my hand on my right. And he even said to me, and this is the most beautiful thing that gets me every single time. He said, which hand can you feel? Because that's the one that I want to hold. Oh, sorry. And he was young. He was like 25 years old, and all these specialists, all these advanced specialists who were doing all these amazing things, thinking they were doing the right thing for me, were actually doing the wrong thing. And he said, I don't know how to say this to you, and I know you've had 3 MRIs already, but I think you need to have another one. He said, I'm not convinced that this is MS, and I don't know who to tell, so I'm just going to tell you. And I was like, thank you for talking to me. Thank you. And he went through and he story told, he GrowthRx. He said, my grandmother went through this, and I remember all she wanted was for somebody to kind of be there for her. And he said, what do you need? I said, I need postnatal care. I'm bleeding. I've got no pads. I've just had a baby. I want a photo of my daughter. They won't give me my phone. What more? I want somebody to be human. That's what I want. I don't want doctors. I don't want nurses. I want some humility. And he started crying. And it was just really nice. It was just really nice. And he went out and he got his doctor. And he says, when I met my surgeon for the first time, and this is where the cloud started to lift, because my surgeon, Dr. Badu Kavar, who heads neurology in Australia here, he's an incredible human being. He is of Pakistani descent, and he came in and he sat with me on the bed, and he lifted me up and he held my hand, and he said to me, you have a lesion in your head. We don't know what it is, but I'll tell you what we do need is we need this to come out, and we need it out now. At the rate that this is growing, you might have 6 weeks to live. And I need to get your husband in here, and you need to start taking measures for your daughter. And you need to spend time with your daughter, because we don't know how long that's going to be. And I want to make sure that you get to spend every second of every hour. So we're going to put you in a private room, and we're going to make it like a bubble so that she is safe and that you can spend every second with her. And they did that. They set up this special ward in neurology ICU that was just me, that was just a bubble, that people came and visited me so that she didn't get sick and I could be with her. And obviously that reunion of seeing my daughter again after 4 days, if there's any regret I have, is not having that on film, because I'd love to watch that now. I'd love to watch that human connection of being reunited with something that's so precious to you that you hadn't been able to see. But there's moving on from that, and obviously I'm here, so thank you for sharing my emotions with me and for allowing me to. This is the first time I've told the story to strangers ever, outside of actually writing it in a blog. So this is healing for me in itself. And as I said, GrowthRx from this moment forward, storytelling is healing, and the therapeutic value from this is so important. But moving on from that, there's one thing that I want to make before I kind of go in and start to deliver some of the lessons that we need to learn from this, because if we're not learning from something, then it is irrelevant. All of this was for nothing. If I can't teach somebody, just one person, one thing about how to address one patient differently so they don't have to go through this, then this is enough for me. So maybe I'll, is there any questions from anybody at the moment before I keep going? No? Okay. So I'm just going to share my screen again. And this is the important lessons now that I want to deliver. Empathy. Empathy is what I teach, and I spent the last 4 years putting together a course in leadership for allied health professionals all over the world. This will be ready in October, and I cannot wait to deliver this to the world. And the catalyst for this is obviously all of the lessons that I learned through teaching things like empathy. Empathy can be taught. I have 12 articles I'll provide to Rachel. Research shows that if empathy can be taught, it can be learned, And if it can be learned, we have a duty of care to spend time teaching it comprehensively in the hospitals, to students, to our children. We need to start teaching empathy. Empathy is not only a human trait, it's a skill, and it's all wrapped up in one beautiful word. It's emotional intelligence, and it's the glue that that glues human connection together. It's the key to understanding emotions, and it's usually what helps us find that connection and build relationships from an immediate stage with a patient. It's through observations, and it strengthens over time, and great practitioners do empathy well, and great practitioners have a duty of care to teach it. And we teach it through mirroring, through observation, through getting people in and showing that vulnerability, and storytelling, and passing on stories and legacies and amazing feats of strength in times like this. And, you know, it is an attitude and it's a skill. So there's a big difference, though, between empathy and compassion. And this is the really important thought leadership I want to put forward today. So, you know, if empathy is our ability to resonate and feel something, it's the tuning fork that puts us in sync with a patient, right? It's what we feel, and part of it's a gut reaction, but we learn it through mirroring the behaviours of another amazing mentor. That's followership. Seeing how somebody else delivers empathy and taking a part of that and doing it yourself and passing that legacy on is so beautiful to watch, and it's beautiful to be a part of. But this is where I think we fall down, and I'm more than happy for you to challenge me in this, but my job is to, I guess, ignite a little bit of a spark of curiosity here that we might be doing this wrong. Because compassion, on the other hand, so if empathy is the front end to compassion, and if empathy is the sensation, then compassion is empathy in action. Now, this is really important because compassion is in fashion right now. You hear the great leaders of the world talking about compassionate leadership. We must do this together. We must do this compassionately. And I argue that because everyone in my world who was experiencing what I was experiencing, and what I say there by definition is sharing pain and suffering together, I didn't want that. I didn't want compassion from people. I had my own pain. And if we are pain providers, one of the things that I'll say to you is when people came in to visit me, they walked in and I was trying so hard to hold on to this positive mindset because that's what kept me going. That was hope for me. And every time somebody came in, they burst into tears and they cried for their own feeling and their own emotion. And I don't argue that because that's what they needed. But did I want anyone to share in my pain and to suffer with me? Absolutely not. And I think that there is a really important definition between teaching empathy, which is so invaluable, and encouraging compassion. Because I believe compassion is going too far. Is there a need for two people to suffer? And when we do it as pain providers, when you share in somebody's pain, and when you actually share suffering, you're multiplying pain. You've gone from one person being in pain to now having two people being in pain. We're multiplying it, and it's not right. Compassion is there for many different reasons. You think about compassion in third world countries, in refugee camps. We offer empathy. We put ourselves in their shoes because we see what we're going through. As the great leaders of the world, we have to offer empathy. We have to think about what they're going through so that we can familiarize ourselves. But can we share in starvation? Can we truly be compassionate to them by sharing in their pain? We cannot. Unless you have experienced it firsthand, real starvation, you cannot show compassion. And as health professionals all over the world right now more than ever, COVID is confusing empathy and compassion, and it's causing burnout. And one of my blogs, if I'm ever going to do a TED talk, it's on this because I am so passionate about this burnout epidemic coming with health professionals in sharing the pain of their patients. You're doubling pain. You are causing multiplication of pain across the world. People trying to fix things, share pain, connect, all that sort of stuff. It's a problem. It's a real problem, and it's really scary. So my point in going through what I went through, did I want people to empathize with me, sit next to me, hold my hand, put themselves in my shoes? Absolutely. Did I want them to share my pain? No. It was a burden. When somebody helps share your pain and you see that pain multiplied, it made me feel bad. It made me feel horrible, the effect that what was going on in my life had now triggered somebody else to be in pain. And it's a really, really important lesson, and it's part of the message that I need. I'm even applying to Melbourne Uni so that I can teach this to medical students, the difference between empathy and compassion. Mindset's what is important here. Mindset, by my definition, is a set of attributes, yes, but more than that. It's emotions, beliefs, and behaviors that actually trigger the action you choose to take. So as pain providers, particularly in psychology and allied health, when you're dealing with a patient, mindset is more important. Helping somebody with mindset. Now, there's a clear distinction. This is where I started to get confused, and where I started my own mindset revolution that did not exist. Okay, and this is what I'm so excited to share with you today, because it's only kind of just sort of come about. But, before I go into that, resilience, the other human trait that people throw around flippantly now as resilience. And so many times, so many people said to me, gosh, you're resilient. Your sense of resilience is amazing here. And I heard that so much. I heard that so much in the first 8 months, even to the point where, and this is going to blow your mind as well, they forced me into psychology and counselling when I said that I didn't really need it. I helped myself through a positive mindset. I was doing okay. And they said, your resilience is not normal. Your strength here is not normal. And we feel like you're repressing some postnatal depressive responses. You're too positive to actually have given yourself the ability to feel the emotions you needed to feel going through this. So they made me go through counselling. I said I didn't need it, and they said, we're really, really worried about you because you're so positive. I mean, they turned a positive into a negative by default. I was going really well, and I'll tell you why. Resilience comes from doing things for other people. The people around me. I had a daughter to worry about. I didn't have time to sit and wallow and play the victim to life. I had a 10-day-old daughter. I was about to go into surgery. What more can you do rather than say, I've got this? I said it multiple times, I've got this. And whatever will be, will be. There's no point, laying down beside opportunity when it is what it is. And I can't help but think everything is exactly as it should be. And if you just stick your head in the sand, you're not learning the valuable lessons that life is delivering you. And so resilience is not always the best result, because by definition, and I looked it up back then because I was hearing it so often. And again, I'm not meaning to lecture you, because lecturing from one adult to another is the most disrespectful thing anyone can do. But resilience, if you go back to that Latin definition, means back, and resolere is the Latin word for resilience, and solere actually means to jump back or to recoil. So it also means, by definition, someone or something, resilience, someone or something going back to their previous state or shape at a very rapid rate. I am not resilient. I am not back to my old shape. If anything, I'm better, but I am certainly not resilient, because I'm not back to what I was before. And by definition, resilience is somebody returning to a previous state or recoiling back to what they were. This experience, this crucible in my life and how I've come through that, did not return me back to what I was before. And whilst it's a beautiful word and it's used in the right, most wonderful, encouraging context, by definition, people in crisis or have gone through something horrible, no matter what it is, are usually not resilient because we don't return. And the world with COVID-19 is not resilient. We are a new normal. We're not ever going to return to what we were before. Otherwise, we haven't learnt the appropriate lessons we should have learnt by going through what we did. I don't want a resilient world. I don't want us to return back to normal. I don't want people to go through crisis. And I don't want to encourage resilience. I want to encourage growth. GrowthRx is learning from a situation and moving forward, not returning to the state you were previously. Lessons are learned through growth, not returning to what you were before. And again, just my way of challenging my own thought leadership here. There is no right or wrong. But the crucibles in our life, we need to learn from them, and we need to learn things about ourselves. So the gratitudist, the birth of the gratitudist, this happened all the time. And people kept saying to me, gosh, you know, you're so optimistic in these times. I wasn't optimistic, because optimistic in itself holds a sense of naivety that everything's going to be okay. I wasn't optimistic. I wasn't naive that I was going to be okay. I was told I had 6 weeks to live. I certainly wasn't in a state of being optimistic. And I also wasn't pessimistic. I wasn't glass half empty either. I wasn't, this is going to turn bad and I'm not going to be okay. And I also wasn't a realist, because realists remove the emotion from it. So I was very real, you know, but I was also very emotional about it. And I kept struggling with what mindset I was in, because there wasn't one to define my story. And so I created one. I started back then calling myself a gratitudist. And it's a new paradigm. It's a word that I feel so strongly about that I trademarked worldwide, because I want to give it a duty of care that I think it deserves. And I want to start a new positive mindset revolution, in that I guess, you know, with this graphic, you don't have to be any of those things. You just have to be grateful for what's in the glass and see it for what it is. You go to these third world countries and you see these children with beautiful smiles on their faces. They don't have anything, but you know what they got? They got something in their glass, and they're grateful for what it is. And they can be positive no matter how half empty or half full it is. See what's in the glass and just appreciate it. Live in the now. And I think for me, I wasn't an optimist. I didn't, you know, I wasn't a pessimist. I didn't see the storm coming as such. But I also wasn't an optimist. I didn't look up and look for the breaks in the blue sky and think that the weather was going to change. A gratitudist lifts the sails, looks around the boat and says, this is what it is. Let's lift the sails. And in most situations, a leader is usually a gratitudist who steps up and captains the ship. So I guess, you know, a gratitudist, you know, by more definition, we see, I guess, opportunity rather than risk, or, you know, they see room for improvement rather than limitations, constructive criticism rather than judgment or falling on deaf ears, and an opportunity to grow and learn. That's what a gratitudist is. And I'm really excited to share that with you, and hope that maybe some of you guys might be gratitudists too, and we can spread the word and create a new mindset that might be able to help people. And I think often by giving something a word and by defining it, we can embrace it a little bit more. And I think that, you know, for me, I think if this word did exist, maybe I would have, you know, got through things or dealt with things a little bit differently. And I come back to my husband all the time. The true heroes in this story are the people who supported me. You're only as strong as the people around you. And my husband is the one suffering. You know, I was positive because I had to be, but he still has PTSD from this. I can't even say that I've got a headache without him falling apart or thinking he's going to end up life without me. My sister, my beautiful sister, without question, when I couldn't breastfeed, she had a 3-month-old baby, and I didn't even know in the 4 days that I was away, she expressed and she fed my daughter. She breastfed my daughter. She fed like she had twins. And when I saw her again after 4 days, she'd lost about 5 kilos. She didn't sleep and she didn't stop. She fed her son and she expressed and she pumped every 3 hours like a brand new mum again. you know, these are the people, these are the things, it's the people around you that give you strength. And if you don't learn from these experiences, and as a pain practitioner, helping guide somebody through this, it's not resilience or compassion or